Now may I call upon Dr. Eli Pradhan Ranjitkar for the guest talk on role of optometrist in primary eye care of retinal diseases. Dr. Eli Pradhan is currently working as a consultant ophthalmologist in medical retina in Tilganga Institute of Ophthalmology. She has participated in pan-European clinical trials in the UK in 5 different studies as a co-investigator. In Nepal, she is a lead investigator of visual function and vision-related quality of life in sight-threatening diabetic retinopathy, as the main clinical team in diabetic retinopathy project in Tilganga Institute of Ophthalmology, funded by Fred Hollows Australia, which is an ongoing project. She is a main leader of formulating national diabetic retinopathy guidelines under TIO and Nepal Ophthalmic Society, which is recently endorsed by Ministry of Health. She is also president of Nepal Vitro-Retina Society and VRS, and actively involved in developing vitro-retinal services in Nepal. Besides, she is recently appointed as a scientific chairman of SAO Ophthalmology. May I here call upon Dr. Eli, ma'am.
Thank you very much. First of all, I would like to thank Mr. Asik Pradhan and Yasasvi Bhattrai to invite me as a guest speaker in this really amazing and wonderful first optometry conference in Nepal. And so the talk I'm going to present is very basic about the retinal diseases. And yeah. Actually, I didn't know what to present, so I asked Asik, and he said just basic about the retinal diseases and how to diagnose. And so this will be more useful for the freshly graduate and younger people probably. Yeah, just the other slide. Next slide. Okay. Sorry. So how do I go back? So as we all know, like optometrists, they are the most important human resources in eye care. So involved in many multitasking, specialty tasks and burden sharing of ocular problems, and also examine, diagnose, treat and manage different disorders of eye, visual system, eye disease and injuries. And also the role in general ophthalmology, as we all know, perform vision test, analyze results, eyeglasses, contact lens, medications, prescription, and also especially for low vision. They are very, very good at low vision aids and all visual rehabilitation, provide pre and post care, undergoing eye surgeries. As the previous speaker said, almost everything is done by optometrists except for eye surgeries, which has to be by ophthalmologists. So also for health education, they are very good counselor, especially to once the diabetes is diagnosed, to refer them to the ophthalmologist for laser or further treatment, also for counseling as well. So many of them, they spend either in a group or in a, as the previous speaker also said, in clinics, either as a single, as in a government, or as a researcher, or as a the main caretaker of the patient. Also, they provide many evidences to the literature. So these are all, again, the roles about medication, patient registration, record keeping, lab investigation, and making spectacles. So what is the role of optometrist in primary care of retinal diseases? History taking is very important. They are able to do dilate fundus examination, both 90D, indirect, direct, for diagnosing of different retinal diseases, conditions, and electrophysiological studies of retina and optic nerve function. Also, they are very good, and I was amazed. I visited Sankar Netralaya last time, and most of these people are so brilliant. They are the one who is doing all investigations, interpreting, even teaching ophthalmologists about all electrophysiological tests. So fundus photography, they are very good at it. Grading retinal photograph. As the telemedicine is coming up, we should teach all ophthalmologists about the grading, fundus photography, FFA, as well as indocyanine green electrophysiological tests, OCT angiogram, interpretation and reporting. So they are also good at measuring intraocular pressure, slit lamp biomicroscopy, assisting in vitreoretinal surgeries, and timing and follow-up of laser treatment. So these are again the repetition of. They are also very good at performing visual field interpretation and advise the consulting ophthalmologist for the further treatment. So the main role now will be the telemedicine, because now everything is, is artificial intelligence or whatever, everything is going into that. And here the role of optometrist comes there will be a huge demand of optometrists in this field. So as in Tilganga, we do have this telemedicine, like we do have diabetic screening. We visit different places of Nepal. We have 13 satellite centers and mid-level staff. They go there with their fundus camera, and if they find any abnormal fundus, they send it to us, and we grade, and they grade, and in the severity of the diseases, they are referred to us. We see the patient and we call them immediately for the treatment. So that's what happening in Tilganga already. So as just to show, this is the normal fundus. This is again for the fresh people. This is the normal fundus of right eye. This is the normal fundus of the left eye. So what happens in diabetes? As you know, this diabetes is like, it's a tip of an iceberg right now. It's explosive, and it's the vast majority of people are having diabetes, and this is going to be a kind of a global burden to the eye care system. So mild diabetic retinopathy, I just wanted to show this, as you see. So as you can see, this is the mild diabetic retinopathy. This is according to early treatment diabetic retinopathy study. So you see all these microaneurysms, small dot hemorrhages here. So you can follow these patients in 3 to 6 months. There are certain guidelines for that. So again, you see these are all tiny microaneurysms there. So you don't need to refer them immediately. You can counsel the patient about the disease, and you can see them after 6 months, and if you find any abnormal findings, refer to the ophthalmologists. So these are venous beading. These are the different features what you find in diabetes. Venous beading. This is the intraretinal microaneurysms. These are the all abnormal blood vessels which happens beneath the retina. Sorry. Am I going back? Yes. So these are again venous beading there. You see the big blood hemorrhages. Then in this instant, probably you might have to refer to the doctor, to the ophthalmologist. Here you see there are plenty of, this is blood hemorrhages there. There's small tiny microaneurysms, and there is involvement of the fovea. Now this patient needs treatment, and it's better to refer them to the ophthalmologist. Similarly, if you do fundus fluorescent angiography, you'll see plenty of microaneurysms there. So there's still a little bit of a sparing of fovea, but then this needs a close monitoring, say about every 3 months. So this moderate NPDR, diabetic retinopathy, hard exudates, dot and blot hemorrhages, venous beading, intraretinal, what you call as ERMA. There's ischemic changes. So in this instant, so this patient needs laser treatment, so refer them. And these actually, whether, it depends, like first you can be as a counselor for the, care of the diabetes care, and also probably refer to the, and especially what happens in our context, many of them, they don't know about the diabetes in their body, because when they come for the first eye check, we happen to see these. So this is the crucial time, and when you do the fundus examination, if you find this, it's better refer them to the physician as well. So severe NPDR, so it's better to